Did you know that one of the most powerful health remedies for seniors might be quietly sitting in your kitchen cabinet right now? It's simple, inexpensive, and familiar, yet its true potential remains largely overlooked by many. I'm talking about baking soda, or sodium bicarbonate, a substance you probably use to freshen your fridge or help baked goods rise, but that also holds surprising benefits for your health. As a doctor and researcher with decades of experience in senior health, I've seen countless natural remedies come and go, but baking soda stands apart. Despite its humble appearance, it offers a range of health-supporting properties, from soothing heartburn to protecting kidney function, easing joint pain, and even refreshing your breath. These benefits, often buried in scientific journals or dismissed as folklore, deserve a fresh look, especially for those navigating the unique challenges of aging. Why is baking soda so effective? At its core, it's all about balance, particularly balancing acidity in your body. As we age, many of our bodily systems face challenges, often linked to changes in pH, inflammation, and metabolic stress. Baking soda, with its alkaline properties, helps gently restore harmony, supporting your body's natural ability to heal and maintain itself. In this video, we'll explore 7 powerful health benefits of baking soda water, specifically for seniors, diving deep into how it works, who should be cautious, and how you can safely incorporate it into your routine. Whether you're struggling with persistent heartburn, worried about kidney health, dealing with painful gout flares, or simply looking for a natural way to feel more energetic and balanced, this guide is for you. But first, a quick story. Mrs. Elaine Turner, a 74-year-old retired teacher, had battled heartburn for years. Night after night, the burning discomfort stole her sleep and clouded her days. After trying various medications, with mixed results and bothersome side effects, she was introduced to a simple solution: a glass of baking soda water. The relief was almost immediate. No prescriptions, no complicated treatments, just a teaspoon of baking soda dissolved in water. For Mrs. Turner, it wasn't just about comfort. It was about reclaiming peace and dignity in her golden years. Stories like Elaine's are not unique. Baking soda's health benefits are supported by growing scientific evidence and personal testimonies alike, yet many remain unaware of its full potential. So, if you're ready to learn about a natural, affordable way to support your health and well-being, keep watching. And if you find value in this video, please subscribe and let me know by typing 1 in the comments below. Let's begin our journey toward smarter, gentler healthcare, starting with something as simple as heartburn relief. Chapter 1: Heartburn and Acid Reflux Relief. A natural soother heartburn. For many seniors, it's an unwelcome companion that seems to come with age. That familiar burning sensation rising from the stomach through the chest, and sometimes all the way to the throat, can be not only painful but disruptive, stealing restful nights and clouding peaceful evenings. After years of practice, I've learned that heartburn is not just a nuisance. It's a signal that your body is asking for help. The most common cause, acid reflux, happens when the stomach's acid flows back up into the esophagus, irritating its delicate lining. Normally, a valve called the lower esophageal sphincter keeps this acid where it belongs, in the stomach. But as we age or due to lifestyle factors, this valve may weaken. Many seniors reach for antacids or proton pump inhibitors, PPIs, to manage symptoms. While these can be effective, they often come with side effects such as nutrient malabsorption or increased infection risk when used long-term. This is where baking soda water offers a simple, natural, and surprisingly effective alternative. How baking soda works. Against heartburn, baking soda is sodium bicarbonate, a base that neutralizes acid. When dissolved in water and swallowed, it acts like a chemical sponge, soaking up excess hydrochloric acid in the stomach. The reaction produces salt, water, and carbon dioxide gas, which often results in quick relief from that burning sensation. Unlike many medications, baking soda works rapidly, often within minutes, to ease the discomfort and pressure caused by acid reflux. It doesn't just mask symptoms, it chemically neutralizes the acid responsible for the burn. A story from my practice. Let me share a story about Mrs. Johnson, a 72-year-old woman who struggled with nighttime heartburn for over a decade. She tried everything: prescription medications, dietary changes, sleeping with her head elevated. But relief was fleeting. Her discomfort made falling asleep difficult, and she dreaded mealtimes. One day, after learning about the natural buffering effects of baking soda, she cautiously tried a half teaspoon dissolved in a glass of water after dinner. To her surprise, the relief was almost immediate. The burning subsided, and she was able to sleep peacefully. Mrs. Johnson incorporated this simple remedy a few times a week, especially after rich meals, which helped reduce her dependence on medications. With regular monitoring and guidance from her doctor, she found that baking soda water offered a gentle, affordable way to manage her symptoms. Important considerations and safety. While baking soda is effective, it's not a cure-all and must be used thoughtfully. Because it contains sodium, seniors with high blood pressure, kidney issues, or heart problems should be cautious and consult their healthcare provider before use. Overuse can cause alkalosis, a dangerous rise in blood pH, increased sodium levels, and gas discomfort from carbon dioxide buildup. Therefore, baking soda should be used as an occasional remedy, not daily or in large amounts. How to use baking soda water for heartburn relief. Here's a safe, practical method for occasional use. Mix 1 to 2 teaspoons of baking soda in 4 to 8 ounces of water. Stir until dissolved completely. Drink slowly to allow the solution to soothe your stomach. Avoid taking it within 2 hours of other medications, especially antibiotics or heart medications. Limit use to no more than 3 times per day and not continuously for more than 2 weeks. Why this matters for seniors. The beauty of baking soda water lies in its simplicity and accessibility. For seniors managing multiple medications, it offers a way to take some control back without extra prescriptions. It is affordable, easy to prepare, and well tolerated when used properly. Imagine ending your day with a warm, comforting drink that calms your stomach's fire and prepares you for restful sleep. That small act can have a profound impact on your quality of life. If you're finding this information helpful, please type 1 in the comments to let me know you're following along. Next, we'll explore how baking soda supports kidney health, a topic often overlooked but critical for aging well. Chapter 2. Supporting Kidney Health. The Silent Helpers. When we talk about health in our senior years, one organ system quietly working behind the scenes deserves our close attention: the kidneys. These remarkable organs filter about 50 gallons of blood daily, removing waste, balancing fluids, and maintaining the delicate acid-alkaline equilibrium essential for every cell in your body. Yet, as time passes, kidney function naturally declines. This decline can accelerate with chronic conditions common in older adults, such as diabetes and hypertension. The consequences: fatigue, swelling, changes in urination, often subtle signs that mask a deeper imbalance. The role of acid in kidney decline, a key contributor to worsening kidney health, is a condition called metabolic acidosis. This happens when the kidneys lose their ability to remove excess acid from the bloodstream. The body becomes more acidic, which can speed up kidney damage and lead to a vicious cycle of decline. Recent research reveals an unexpected ally in this battle against acid buildup: baking soda, sodium bicarbonate. By acting as a buffer, baking soda helps neutralize excess acid, easing the burden on the kidneys. Scientific evidence supporting baking soda in kidney health. A notable long-term study showed that patients with early-stage chronic kidney disease, CKD, who took sodium bicarbonate supplements experienced a slower decline in kidney function compared to those who didn't. Some even avoided the need for dialysis altogether, a life-changing outcome. This is not just theory, it's a practical, affordable way to support kidney health that deserves more awareness. A patient's journey. Mr. Lee's story. Mr. Lee, 68, was diagnosed with stage 3 CKD during a routine checkup. Like many seniors, he feared the prospect of dialysis and the limitations it would impose. Under his nephrologist's supervision, he incorporated small doses of baking soda water into his treatment plan. Over the following months, his kidney function stabilized. While not a cure, the baking soda helped buffer his blood's acidity, easing his kidneys' workload. Mr. Lee felt empowered, knowing he was taking an active role in supporting his health through this simple remedy. Important precautions. While promising, baking soda is not suitable for everyone. For those with advanced kidney disease, heart failure, or fluid retention, excess sodium from baking soda can worsen symptoms. Always discuss with your healthcare provider before starting. Proper dosage and medical supervision are essential to ensure safety and effectiveness. Remember, baking soda is a supportive adjunct, not a replacement for medical care. How seniors can safely use baking soda for kidney support use only under medical guidance. Typical doses range from 1+2 teaspoon to 1 teaspoon in water, once or twice daily, but individualized plans are best. Monitor blood pressure, fluid retention, and kidney function regularly. Avoid simultaneous use with certain medications. Consult your doctor. Why this matters for seniors. Facing the challenges of declining kidney function, baking soda offers hope. A gentle, natural supplement that can extend independence and improve quality of life. When combined with a healthy lifestyle and medical care, this simple powder becomes a powerful ally. Imagine having a low-cost, accessible tool that supports your body's silent workers, the kidneys, enabling you to continue enjoying daily activities without invasive treatments looming on the horizon. If this insight resonates, please type 1 in the comments below to let me know you're with me. Next, we'll delve into how baking soda water may ease the discomfort of urinary tract infections, another common and frustrating challenge for seniors. Chapter 3. Easing urinary tract infection discomfort. A gentle ally. Urinary tract infections, UTIs, are one of the most common and distressing health problems facing seniors, especially women. The sudden onset of burning pain, frequent urgent urination, and pelvic discomfort can disrupt daily life and steal restful nights. For many, UTIs become a frustrating cycle of recurring infections and antibiotic treatments. While antibiotics remain the primary and essential treatment for UTIs, there is growing interest in supportive, natural approaches to reduce discomfort and potentially prevent flare-ups. One such approach is using baking soda water as a gentle urinary alkalizer. Why urine pH matters in UTIs. The bacteria most often responsible for UTIs, particularly E. coli, thrive in an acidic environment. By increasing urine alkalinity, raising its pH, we can create a less hospitable environment for these bacteria. Baking soda, when dissolved in water and consumed, increases the pH of urine temporarily, which may reduce bacterial growth and inflammation, easing discomfort between infections. The science behind baking soda and UTI relief clinical studies suggest that women who incorporate baking soda into their care routines experience fewer UTI flare-ups and report less burning and urgency. While baking soda is not an antibiotic and does not replace medical treatment, its role as a supportive measure is promising. A personal story: Ms. Martinez's experience. Ms. Martinez, a 70-year-old retired nurse, battled recurrent UTIs that significantly affected her quality of life. Frequent doctor visits, antibiotics, and lingering discomfort left her exhausted and anxious. On her physician's advice, she began taking half a teaspoon of baking soda dissolved in water daily during flare-ups. Over time, Ms. Martinez noticed reduced irritation and fewer infections. The baking soda water gave her a small but meaningful sense of control and comfort, complementing her medical treatment. Important safety notes. Baking soda is not a substitute for antibiotics or medical care. UTIs can worsen quickly in seniors and must be treated promptly by healthcare providers. Excessive use of baking soda can cause alkalosis or worsen conditions like high blood pressure due to sodium content. Always discuss with your doctor before starting. How to use baking soda water for UTI symptom relief. Dissolve 1-2 teaspoon baking soda in 1 glass, 8 oz, of warm water. Drink slowly once or twice a day during symptoms or as advised by your healthcare provider. Do not exceed recommended doses or use continuously without supervision. Combine with plenty of water intake and follow prescribed treatments. Why this matters for seniors. Recurring UTIs can be a source of physical discomfort and emotional stress. Baking soda water, as a simple, natural adjunct, can offer relief from the burning and urgency that often linger between infections. For seniors managing multiple medications, it represents a safe, accessible option to regain comfort and peace of mind. Imagine having a gentle, immediate remedy to soothe urinary discomfort while awaiting medical care or between antibiotic courses. That small step can make a significant difference. If you're finding these insights helpful, please type 1 below. Next, we will explore how baking soda water may help reduce painful gout flare-ups, a condition that can strike suddenly and severely in seniors. Chapter 4. Managing gout flares naturally. Easing the sharp pain. If you've ever woken in the middle of the night with a joint so swollen, red, and painful that even the light touch of a bedsheet feels unbearable, you understand the cruel grip of gout. For many seniors, gout can feel like a betrayal, especially after years of effort to maintain a healthy lifestyle. Understanding gout and its causes. At the heart of gout is a substance called uric acid. Normally, your body processes and eliminates uric acid effectively. But when levels build up excessively, uric acid crystallizes and deposits in joints, most commonly the big toe, but also ankles, knees, and wrists. These needle-like crystals trigger intense inflammation and pain, often suddenly and unpredictably. How baking soda may help. One lesser-known but scientifically promising approach is to use baking soda to increase the alkalinity of the body. Why does this matter? Uric acid is more soluble in an alkaline environment, which means it can dissolve more easily in urine and be flushed out, reducing crystal formation. By drinking a properly prepared baking soda solution, you may subtly shift your body's pH to a more alkaline state, which helps prevent and mitigate gout flares. What the research shows, emerging studies suggest that sodium bicarbonate, under medical supervision, can reduce uric acid levels and ease metabolic imbalances that predispose to gout attacks. While baking soda is not a replacement for medications like allopurinol or NSAIDs, it offers a natural adjunct that may reduce flare frequency and severity. Patient story: Mr. Davis's relief journey. Mr. Davis, a 75-year-old retired mechanic, experienced recurrent painful gout flares that disrupted his life. Despite following dietary advice and medications, flare-ups persisted. Under his doctor's guidance, he added a baking soda water regimen, a teaspoon dissolved in water daily after meals. Over several months, Mr. Davis noticed fewer attacks and milder symptoms when flares occurred. This simple change gave him hope and improved his quality of life, complementing his prescribed treatments. Safe use guidelines. Always use baking soda for gout management under medical supervision. Typical doses are around 1:2 to 1 teaspoon in water once or twice daily, individualized per patient needs. Monitor uric acid levels and kidney function regularly. Avoid excessive use to prevent side effects like alkalosis or sodium overload. Empowerment. Through small steps. The ritual of stirring a spoonful of baking soda into warm water becomes more than a remedy. It's a moment of self-care and respect for your body's needs. In the face of painful flares, this small act can foster a sense of control and healing dignity. If you found this chapter insightful, please comment 1 to keep the conversation going. Next, we'll explore how baking soda can support your oral health, freshening breath and soothing mouth sores. Chapter 5. Oral health benefits, mouth sores, and bad breath. As we age, many subtle health changes become more noticeable, including those affecting our mouths. Dryness, soreness, sensitivity, and bad breath can all impact confidence and quality of life. Why oral health matters in seniors' medications, reduced saliva production, dentures, and systemic health conditions contribute to oral discomfort. Mouth sores, such as canker sores or denture irritations, may linger, making eating and speaking uncomfortable. Bad breath, or halitosis, can be emotionally distressing and socially limiting. How baking soda helps. Baking soda's mild alkalinity neutralizes acids in the mouth, creating a less hospitable environment for bacteria responsible for bad breath and tissue irritation. Additionally, baking soda gently cleanses and soothes the oral mucosa without the harshness of alcohol-based mouthwashes. Real-life example: Mrs. Green's Relief. Mrs. Green, 78, suffered from painful denture sores and persistent bad breath. After starting a simple daily rinse of half a teaspoon baking soda dissolved in warm water, she noticed less soreness and fresher breath within days. This gentle rinse helped restore her confidence to smile and speak without worry. How to use baking soda for oral health. Dissolve 1 to 2 teaspoon baking soda in 8 ounces of warm water. Use as a mouth rinse for 30 seconds to 1 minute, then spit out. Repeat once or twice daily as needed. Do not swallow the rinse. Consult your dentist for persistent oral health issues. Safety considerations. Baking soda is generally safe as a rinse, but excessive use may disrupt natural mouth flora. Balance and moderation are key. Why this matters: oral health is integral to overall well-being, affecting nutrition, communication, and social interaction. Baking soda offers a simple, cost-effective way to support this vital aspect of senior health. If you're following along, please comment 1 below. Next, we'll discuss how baking soda water can help reduce post-exercise muscle soreness, aiding recovery and mobility. Chapter 6. Reducing post-exercise muscle soreness. Supporting recovery naturally. For many seniors, staying active is a precious gift, a way to maintain independence, strengthen the heart, and connect with life's rhythms. Whether it's a morning walk, gardening, or gentle physical therapy, movement fuels vitality. Yet, with activity often comes muscle soreness, the ache and stiffness that appear a day or 2 after exertion, known as delayed onset muscle soreness, DOMS. This discomfort can discourage continued movement, threatening the very independent seniors strive to preserve. Understanding muscle soreness. Muscle soreness after exercise is primarily caused by the buildup of lactic acid and microscopic muscle damage during activity. While some soreness is a natural part of strengthening, excessive discomfort can limit mobility and reduce quality of life. How baking soda helps. Baking soda acts as a natural buffer inside the body, neutralizing excess acid, such as lactic acid accumulated during exercise. Drinking a small glass of baking soda water shortly after physical activity can ease muscle acidity, reducing soreness and stiffness. A senior's story. Mr. Thompson's recovery boost. Mr. Thompson, 70, recently returned to daily walking after a knee surgery. Although motivated, he struggled with post-walk soreness that made him hesitant to continue. Under medical advice, he began drinking a teaspoon of baking soda dissolved in water after his walks. Over weeks, Mr. Thompson noticed his muscles felt less achy the next day, allowing him to increase activity gradually and regain confidence. How to use baking soda for muscle recovery mix. 1/2 to 1 teaspoon baking soda in 8 ounces of water soon after exercise. Drink slowly to help buffer lactic acid buildup. Do not exceed recommended doses. Combine with hydration and proper stretching. Important considerations. Seniors with health conditions affected by sodium intake should consult their doctors before use. The psychological benefit beyond the physical relief. The ritual of preparing and drinking baking soda water offers psychological comfort. A moment of self-care, reinforcing a positive relationship with the body. If you're finding this helpful, please comment 1 below. Up next, how baking soda supports balanced body pH, a foundation for energy, immunity, and cellular health. Chapter 7. Supporting balanced body pH, the foundation of vitality. Our bodies are masterpieces of balance. Every breath, every heartbeat, every repair process depends on maintaining precise chemical harmony. One crucial aspect of this balance is the acid-alkaline, pH, equilibrium in our blood and tissues. Why pH balance matters. Even a slight shift toward acidity can leave us feeling tired, achy, inflamed, and vulnerable to chronic conditions. Aging naturally diminishes the body's ability to buffer excess acid, making seniors more susceptible to the effects of an acidic internal environment. Modern lifestyle challenges. The typical modern diet, high in meats, processed foods, and sugars, with fewer fresh vegetables, pushes the body toward acidity. Add stress, medications, and reduced physical activity, and the struggle to maintain pH balance intensifies. How baking soda supports pH balance. Baking soda, as sodium bicarbonate, acts as a gentle alkaline buffer, neutralizing excess acids in the body. When consumed in small, controlled amounts, it supports the kidneys and lungs in maintaining healthy pH, easing the strain on these vital organs. Real-life benefits. Many seniors who include occasional baking soda water in their routine report feeling lighter, more energetic, and less joint stiffness. This isn't magic. It's chemistry working wisely with your body's natural systems. Cautions on over-alkalization. It's important to avoid extremes. The goal is balance, not turning your body into an alkaline fortress, which can disrupt other processes. Moderation and medical guidance ensure safe, beneficial use. Practical tips for seniors' use. Baking soda water a few times a week as a supportive measure. Combine with a balanced diet rich in vegetables and hydration. Maintain regular exercise and stress management. Consult healthcare providers for personalized advice. The bigger picture. Maintaining balanced pH affects digestion, sleep, immune response, and cellular repair. Supporting this balance is foundational to aging well and enjoying a vibrant life. If this chapter resonates with you, please comment. 1. Coming next is a bonus look at baking soda's role in skin health, soothing dryness and irritation naturally. Bonus: baking soda and skin health. Soothing from the outside. In our skin is the body's largest organ and often reflects our internal health. Aging skin can become dry, itchy, and irritated, sometimes affected by the body's internal acid-base imbalance. How acidity affects the skin. When the body's internal environment shifts toward acidity, skin may respond with dryness, redness, and discomfort. These symptoms can erode confidence and quality of life, especially in seniors. Baking soda as a gentle external soother. Using baking soda externally, in baths or rinses, can help neutralize surface acidity and calm irritated skin. This traditional remedy, backed by its mild alkalinity, offers relief without harsh chemicals or fragrances. How to use baking soda for skincare. Baking soda bath. Add 1/4 to 1/2 cup of baking soda to a warm bath. Soak for 15 to 20 minutes to soothe itchy or irritated skin. Rinse. Dissolve 1 tablespoon in a quart of water for a gentle skin rinse. Always test a small skin patch first to check for sensitivity. Safety notes. Avoid prolonged or excessive use, which may disrupt natural skin oils and microbiome. Consult a dermatologist if you have chronic skin conditions. Why this matters: natural skincare supports dignity and comfort. Baking soda offers a simple, affordable option to ease minor skin discomforts and promote relaxation. Conclusion: embracing simplicity for lasting wellness. As we journey through life, the wisdom of simplicity often becomes clear. Baking soda, a humble kitchen staple, carries quiet but profound healing potential for seniors. From soothing heartburn and supporting kidney health to easing joint pain and refreshing breath, its benefits span body and spirit. The key is mindful, balanced use under guidance, embracing natural remedies alongside medical care. Your health is your most valuable asset. Small steps, like a spoonful of baking soda in water, can restore comfort, support vitality, and empower you to live fully with dignity. Thank you for joining me on this exploration. I encourage you to share these insights with loved ones and continue asking questions about your health. Your journey toward wellness is ongoing, and every thoughtful choice matters.